Nocturnal symptoms of diabetes you shouldn't ignore. Ever wondered about the signs of diabetes that show up at night? It's not something most people think about regularly, but recognizing these symptoms can be crucial. Today, let's dive into the subtle yet telling signs of diabetes that often reveal themselves when the sun goes down. These nighttime clues can provide important insights into your overall health. One of the early symptoms of diabetes is frequent urination. If you find yourself getting up multiple times during the night to use the bathroom, it could be disrupting your sleep and might be a sign of diabetes. This happens because, with diabetes, excess sugar or glucose accumulates in your bloodstream. Your kidneys kick into overdrive to filter and absorb this surplus sugar. When they can't keep up, the extra glucose gets flushed out through your urine, taking fluids from your tissues along with it. This process increases your need to urinate. This physiological response is your body's way of trying to get rid of the excess sugar, and it's a potential red flag for diabetes. Our next symptom is restless leg syndrome. Restless leg syndrome is a neurological disorder that's often underrated but quite common. This condition is characterized by an uncontrollable and overwhelming urge to move your legs, usually accompanied by strange and uncomfortable sensations deep within them. These sensations can be tough to describe, but are often compared to aches, tickles, or even a creepy, crawly feeling. You might be wondering how this ties into diabetes. The connection actually lies in the nerves. Persistent high blood sugar levels, which are a hallmark of diabetes, can gradually damage your nerves. This condition, known as peripheral neuropathy, is a common complication of diabetes and can trigger restless leg syndrome. Damaged nerves send mixed signals to the brain, resulting in the constant need to move your legs. If you've been dealing with discomfort or an irresistible urge to move your legs, it might be time to get your blood sugar levels checked. Another key symptom to watch for is night sweats. If you often wake up in the middle of the night drenched in sweat, it could be a sign of diabetes. Night sweats often happen because of low blood sugar levels at night, a condition known as nocturnal hypoglycemia. When your blood sugar drops to low, your body releases emergency hormones to bring it back up, which can result in excessive sweating. Managing your medication and adjusting your diet can help control night sweats, but always consult with a healthcare professional before making any changes. Another symptom to be aware of is hypoglycemia. This doesn't just cause sweating and trembling. It can also lead to a sudden increase in hunger, confusion, blurred vision, and even heart palpitations during the night. Hyperglycemia, or low blood sugar, is a condition closely linked with diabetes. These symptoms tend to appear at night because your body still needs energy even while you rest. As glucose levels drop, your body sends signals through these symptoms to indicate the need for a glucose boost. Managing these nighttime symptoms involves regularly monitoring your blood sugar levels and maintaining a balanced diet. It's also essential to discuss any medications with your healthcare provider, as some drugs can impact your blood sugar levels. In some cases, having a nighttime snack that includes complex carbohydrates and protein might be recommended to help keep your blood sugar levels stable throughout the night. Taking the fifth spot on our list is the sleep disorder known as sleep apnea. This condition is characterized by frequent pauses in breathing during sleep. These pauses, known as apneas, can occur numerous times during the night, disrupting sleep and often causing fatigue the next day. The link between sleep apnea and diabetes is especially notable. Research shows that individuals with diabetes, particularly type 2 diabetes, have a significantly higher risk of experiencing sleep apnea. There are several reasons for this connection. One major factor is that both conditions are linked to obesity. Excess fat around the neck can obstruct the airway, leading to episodes of sleep apnea. Moreover, the metabolic disturbances associated with diabetes, such as insulin resistance, can directly contribute to the development of sleep apnea. Insulin resistance disrupts the body's energy balance during sleep, which can lead to breathing interruptions. This complex interaction of factors contributes to the heightened risk of sleep apnea in individuals with diabetes. Another symptom to be vigilant about is dry mouth, medically known as xerostomia. This condition, characterized by a lack of saliva, may cause you to wake up frequently with a parched mouth, even if you're staying well hydrated. Dry mouth can potentially be a sign of diabetes. High blood sugar levels can reduce saliva production, leading to this uncomfortable symptom. Additionally, elevated blood sugar levels can increase urination, contributing to dehydration and further exacerbating dry mouth. Managing dry mouth involves maintaining excellent oral hygiene, staying hydrated, and using saliva substitutes or stimulants if needed. Chewing sugar-free gum or sucking on sugar-free candies can also help stimulate saliva production. It's important to consult with a healthcare professional for an accurate diagnosis and appropriate treatment. Our next symptom to watch for is fatigue. If you're constantly feeling tired despite getting enough sleep, it could be a sign of diabetes. Fatigue in diabetes arises from the body's inability to efficiently use glucose as an energy source. When your body can't convert food into energy properly, either due to insufficient insulin or insulin resistance, you may experience persistent weariness. This happens because your cells aren't receiving the glucose they need to function at their best. Managing fatigue in diabetes involves maintaining stable blood sugar levels. You can achieve this through regular physical activity, a balanced diet, and regular checkups with your healthcare provider. These steps help ensure your body can manage glucose effectively and reduce feelings of fatigue. It's important to ensure your body gets sufficient rest and that you manage stress effectively to help combat fatigue associated with diabetes. Next, let's discuss the symptom of increased thirst, also known as polydipsia. If you frequently wake up in the night with a dry mouth and an unusually strong sensation of thirst, it could be a clear sign of diabetes. This occurs because high blood sugar levels prompt your kidneys to work harder to filter and absorb excess sugar. When your kidneys can't keep up with filtering excess sugar, it gets excreted into your urine, pulling fluids from your tissues. This leads to more frequent urination, which can leave you feeling dehydrated and trigger increased thirst. Managing this symptom involves maintaining stable blood sugar levels. To keep your symptoms under control, it's important to regularly monitor your blood sugar, maintain a balanced diet, engage in regular physical activity, and take any medications prescribed by your doctor. Consulting your healthcare provider is crucial for personalized guidance on managing diabetes symptoms effectively. Don't ignore increased thirst, especially if it's accompanied by other signs of diabetes. It's your body's way of signaling that something might be amiss and requires attention. Lastly, it's crucial to note the occurrence of sleep disturbances. If you're experiencing insomnia or other nighttime restlessness, it could be linked to diabetes. Chronic sleep disturbances are common in individuals with diabetes because the body struggles to regulate blood sugar levels, leading to nighttime hyperglycemia or hypoglycemia. Hyperglycemia high blood sugar or hypoglycemia low blood sugar can trigger symptoms like sweating, shaking, and frequent urination that disrupt sleep. Managing these sleep disturbances typically involves better controlling blood sugar levels through medication, diet changes, and exercise. Therapies such as cognitive behavioral therapy can also help address insomnia. Therefore, if you're experiencing trouble sleeping, it's important to consider the possibility of diabetes and consult a healthcare professional for an accurate diagnosis and appropriate treatment. To summarize, the symptoms of diabetes that can manifest at night include frequent urination, night sweats, symptoms of hyperglycemia and hypoglycemia, restless leg syndrome, sleep apnea, increased thirst, fatigue, dry mouth, and sleep disturbances. Absolutely, it's important to remember that while these symptoms can suggest diabetes, they are not definitive proof. Consulting with a healthcare professional is always the best course of action if you're experiencing any of these signs. Diabetes is a widespread condition that affects millions globally. Recognizing and understanding these nighttime symptoms can aid in early detection and effective management. If you are experiencing one or more of these diabetes symptoms we mentioned in the video, please do not forget to mention it in the comments. Share this video with friends and family who might find it helpful, and don't forget to like, subscribe, and click the bell icon to stay updated with our latest health tips and information. Thank you for watching. We'll see you in the next video.